So the newer algorithm of KD205 will help tremendously in my patient practice with the darker complected people as myself. We struggled a bit before, and now I think with this newer technology, we're able to assess blood flow, assess tissue oxygenation, and also be able to more accurately see the hemoglobin and the oxygenated hemoglobin in these darker complected individuals. Moving forward, I also struggled with amputation levels because even in the areas with darker complected people, if you took an image maybe more proximal to the knee and the wound is perhaps on the foot, just as a comparison, I wasn't able to get accurate comparisons to assess to see if the patient had sufficient blood flow where he or she would need an amputation below the knee or above the knee. Whereas now, I think there will be more information and data to help us with that with these darker complected individuals. So with the new version also, being able to assess the wound and also the peri-wound more confluently in the darker complected individual is very important. We've been able to more accurately see the tissue oxygenation and be able to differentiate it from perhaps a very large inflammatory response to actually bringing it back down to a regular inflammatory response and then moving on to a proliferative and then finally the remodeling stage. I also in my practice had noticed quite a bit of the ability for the lighter complected individual using the Kent snapshot to see the remodeling phase and the need for hemoglobin and oxygenated hemoglobin, even weeks to months after the wound appeared to be closed. So we knew that there was something actually happening in that remodeling stage. I think that that's important with these darker complected individuals. I was not able to do that, and sometimes visualization of epithelium does not always appear so easily assessed, especially when you have healing on a darker complected individual, that skin may be lighter in comparison. And so when you're actually being able to compare the healed area and the peri-wound area, you can see it more. It's just a more striking visualization and able to make better assessments to where they are in the wound healing continuum.